All right, so why do I prefer this position over this position? Many reasons, actually. One, because many people are going to realize that their latissimus dorsi, this muscle where the roll is basically laying right now, is very sensitive. And two, because I want you to be able to adjust how you move through the exercise and also how much of your body weight pushes on this roll, because then you can iterate this exercise more to exactly what you need. So let me explain. Let me get this roll a little bit more under me. First thing I want to do is drop my head down. Now, in many cases, this technically would not be good posture. However, in this instance, it's great because A, it allows me to relax and also stretch the left side of my neck. So then when I'm doing the other side, I can do the same, but I can also compare my right side to my left side, because if we have this imbalance, as I always say, it ends up being a tug of war between Team Navy SEALs and Team Toddlers, and this is not what we want for our body. The second thing is when my head is relaxed, I don't need to hold it as if I'm doing a sit-up, and I can use this hand to help me guide myself through the position A, or B, relieve some of my body weight as I do this exercise. So you've also noticed that I am rolling east to west. Sometimes up and down, left and right get a bit confusing. So right now I am going literally, I would say forward and back, but for the videos, let's say east and west. What this allows me to do is breathe during the exercise, relax, find an area which is a bit tense, and then once I find it, remaining on the hips, I begin to just scoot in a very small movement, if you will. So I always joke and tell my clients it's like a bear scratching his back against a tree. But what this allows you to do is relax, support yourself either against the foam roll or the floor if you need to, or just rest your hand and really relax that tissue, work in there deeply and breathe. Because if I am fighting it because it's so painful, which you also might be on the floor, then just get a softer surface, do it on your mattress, do it with a pillow underneath, whatever, but you're able to control it much better. And then when I have relaxed or when I have worked on that area enough, all I have to do now is just scoot up a little bit higher. I usually say one vertebrae at a time and start the process over. Now, you're going to recognize I'm always doing this east to west rolling first, because often what you will realize is the sensitive spot that you're going to find is going to sometimes be in a different area than it was before. Mine is usually a little bit more on the backside here. So now from here, I, again, can start rolling or shifting, if you will, for my hips. You're more than welcome to come up and lift your butt in the air. That's fine. But what you're going to recognize is this is just a much easier position to maintain. It's much more sustainable, and it's easily scalable to all of my clients, especially when their painful areas are in a different place. And it's also a nice little test to check the neck and make sure that they're able to really relax it, A, just from their nervous system and the ability to actually relax, but B, if they also have the range of motion that allows it to drop on their shoulder. Now, a little tip, because as we come up farther and farther and farther, we're gonna get to where we're basically over our ribs. Now, this is gonna be a little bit harder because now we're gonna need greater range of motion in our neck. And also, you're going to realize that the first few times you roll over your ribs, it's going to be a bit painful. Now, bone is the most sensitive tissue in the body, so often we are told that maybe we shouldn't roll over our bones because this is painful and maybe a bit counterintuitive or dangerous or contraindicative. But actually, really, in my opinion, what's going on is I'll show this muscle right here, the serratus anterior, which is a very important muscle that actually sits over the ribs and works on stabilizing the shoulder blade, if you will. So it really prevents the winging of the scapula, as we would say in fancy terms. And if this muscle really kind of gets, how do I want to say it, tacked down and not really moving like it should, then the best thing we can do is just kind of do some light mobility over it. Now, as I've been chatting with you and just rolling, it already has gotten better. So the point here is we do not want to confuse some sensitivity in our bone that might actually not exist with the actual serratus anterior, basically just telling us it needs a little bit of love and help. Now, the cool thing with this exercise is as you go all the way to the top and you get to kind of the corner of your ribs, if you will realize when there's really no more to do, because then you're just going to be in this crevice where it doesn't make much sense. And again, which I did not do over the serratus anterior, is when you're done rolling right and left, always go ahead and finish moving in this position where you're you're going north to south. Now, in my case, as I'm chatting with you, I'm lifting my head in the air, but at any time I feel my neck getting a bit tight, I just set it back down and go ahead and relax my neck the entire time. Now, you're gonna recognize that this exercise can go quite long because you can start all the way basically where your tricep and your lats roughly meet, and you can go all the way down to where you just saw it. I like to call this position the TV watching position because it reminds me of those people that like long walks on the beach. But remember this position, you can hold it like this if you need to. I would highly suggest keeping the right arm, in this case, as relaxed as possible, because anytime there's tension in the muscle, just like a massage, it would really make no sense. Trying to work on your quad and you're contracting it the entire time, we're not gonna get too far. So because you can really take a long time on each side, I would suggest turning the TV on, putting your dog or your kid on the floor, grabbing a glass of wine, and making sure you focus on both sides, but whatever side is more painful, do that side on a 2-to-1 ratio at the beginning. Because most likely, the side that's more sensitive, that has more pain, is probably the side in which your pain is coming from. So experiment with it, play with it, see how it goes, drop in the comments below what you think, and hopefully you will realize that this really allows you to go much deeper into the foam rolling exercise, and you notice some great benefits. So if you enjoy my videos, please, if you have not already, subscribe. Check me out on TikTok at Unbreakable Body or Instagram at RehabGTS. And if you want to try a 5-day challenge and or just get in contact with me and have a discussion about my 3-month coaching program, all the links are down below. Thank you for taking the time to watch this video. And if you know anyone else that needs any help, please feel free to share this video with them and show the love.